In part 2 of this special report, we go beyond the rollout to unpack the science behind Lenacapavir, how it works in the body, what makes it different from other prevention tools, and what the evidence says about its safety and effectiveness. Uganda has made significant progress in reducing new HIV infections from 96,000 in 2010 to about 37,000 by the end of 2025 and is expanding access to treatment to over 1.4 million people. However, HIV remains a significant public health challenge across the country, with new infections continuing to occur alongside persistent social, economic and structural barriers to prevention. Dr. Vincent Bagambe, the Director of Planning and Strategic Information at the Uganda AIDS Commission, reiterates Uganda's notable progress in reducing new infections and AIDS-related deaths over the years.
We have been able to put 1.3 million people. Of the 1.5 million people, 1,300,000 on treatment. And because of putting all those people on treatment and sustaining them on treatment, we are beginning to see a reduction in HIV infections.
Dr. Bagambe notes that while women continue to bear a higher burden of infection, men often present later in care, which contributes to higher mortality among males.
Of the 1.5 million people living with HIV, 930,000 are women. While about 570,000 are male. Also, if you look at the new HIV infections, 32,000 out of the 37,000 are adults, but importantly, 21,000 are women.
He adds that despite these gains, challenges remain.
We see new HIV infections occurring more in urban areas compared to rural communities, and therefore the urban centers or regions which have high urban activity also tend to double as regions with high new HIV infections.
Health experts say that despite existing prevention tools, Uganda still needs more long-acting and user-friendly options to further reduce new infections. However, as one of the tools to curb down on new infections to people who are at risk of HIV, Lenacapavir, a groundbreaking twice-yearly injectable pre-exposure prophylaxis PrEP for HIV prevention, was officially launched in Uganda on 17th April 2026. Developed by Gilead Sciences, the long-acting drug has demonstrated up to 99% effectiveness and provides continuous HIV protection with just one injection administered every 6 months. Researchers involved in the development and testing of Lenacapavir say evidence from clinical studies has demonstrated high levels of protection against HIV transmission.
Lenacapavir was tried and tested and proven that it can suppress HIV for people who are failed on all other regimens. They are called heavily treatment experienced individuals, and in May 2022, this drug was approved for that indication.
Dr. Flavia Matovu-Chiwewa of the Makerere University Johns Hopkins University Muju Research Collaboration said evidence from clinical studies has demonstrated high levels of protection against HIV transmission, as results from the Purpose 1 study showed that Lenacapavir provided almost complete protection against HIV infection among participants. The study involved about 5,000 adolescent girls and young women, while the Purpose 2 study focused more on key high-risk groups. She further explains who is eligible to receive Lenacapavir and how it is administered.
When we're giving Lenacapavir, even in the studies, we gave loading dose. The loading dose, you take 2 tablets on the day you receive the injection, and then you take 2 tablets the following day. And then by the end of the following day, those are 48 hours, you have enough drug in your body to protect you. If you only get the injection of Lenacapavir, it can even take a month. Remember, it is long-acting. So it's still that the drug levels go up slowly, that way they will go down slowly in your body.
Dr. Flavia adds that Lenacapavir, a 6-month HIV prevention injection, marks a shift from daily pills to longer-acting options designed to make prevention easier, more discreet, and more effective for people at risk.
We've had condoms for so many years, decades, but why are we still seeing new infections? It's because people are not able to consistently use condoms. And then we've had oral PrEP since 2017. Ministry of Health introduced oral PrEP in different clinics, but again, we're still seeing so many infections. Currently, we have about 100 infections occurring in Uganda per day. From the day we wake up to the time, the moment we wake up to the time we shall go to sleep, we'll have 100 people seroconverting in Uganda. It's wonderful that we can have an intervention from a pill every day to just two injections in a year.
During the initial phase of rollout, health authorities have prioritized pregnant and breastfeeding women due to their increased vulnerability to HIV infections. As Dr. Flavia explains, researchers are continuing to monitor the drug's long-term safety and effectiveness through ongoing studies.
Currently, because after the results came out and Len was 100% protective, we moved everyone from, even those who were in the groups for tablets, because we had the groups for tablets and for the injection. We rolled over everyone to the injection, what we call the open label extension phase. So we are still following up these women and young girls in Purpose 1 and the men in Purpose 2.
While supply is limited, Dr. Flavia says there is optimism that production and access will increase as more partnerships with generic manufacturers are established. In Uganda, the Ministry of Health officially designated specific priority populations for the Lenacapavir rollout program across accredited health facilities. Because current supplies are limited, doses are strictly prioritized for individuals at the highest risk of exposure. The primary targeted groups under the Uganda National Framework include adolescent girls and young women, people in serodiscordant relationships, pregnant and breastfeeding mothers, commercial sex workers, classified as key groups with persistent high-frequency occupation exposure, high mobile populations that include long-distance truck drivers and transport workers who spend prolonged periods away from home, border riders included, and the mobile urban demographic categories experiencing elevated community transmission rates. Military and security personnel among the high-interest groups as well. Jacqueline Makoha, the UNAIDS country director for Uganda, says ending AIDS will require both medical advances and social change, emphasizing that while new prevention tools are promising, stigma and discrimination remain major barriers to HIV response efforts. She urges countries to scale up access to new prevention technologies, including Lenacapavir, to reduce new infections.
Because of stigma and discrimination, either self-stigma or fear of being stigmatized at health facilities, a lot of people fall out of treatment. And unfortunately, these are the people that we are missing out. And so the challenge is and the HIV program has been doing an excellent job of identifying what we call people who are not adhering to treatment. Yeah, identifying them, following them up through the community health workers, identifying where they are, supporting them to keep on treatment. So, Lenacapavir, yes, will not have an immediate impact on that, but by preventing new HIV infections, we ensure that we don't have the pool of people living with HIV does not continue growing.
Despite optimism surrounding the new prevention tool, health experts have cautioned that Lenacapavir only protects against HIV and does not prevent sexually transmitted infections, STIs, hepatitis B, or unintended pregnancies. Therefore, communities have been urged to continue using comprehensive HIV prevention measures.
I would like to remind the public that we still have other prevention technologies. The condom remains very effective. It's easily accessible in Uganda through the health facilities, through community distribution points. We also have them in the pharmacies, in private shops. So condoms remain widely available and they are effective. We also have oral PrEP, which is highly effective. We have the ring for women, which also is highly effective. And now we have Lenacapavir. So we have a lot of choices.
Lenacapavir has already been introduced in several African countries as part of early rollout programs supported by global health partners. The countries include Eswatini, Kenya, Lesotho, Nigeria, Uganda, Zambia, Zimbabwe, and Mozambique. As Uganda continues to push towards its goal of ending AIDS as a public health threat by 2030, a total of 300 health facilities are expected to provide Lenacapavir for PrEP by December 2026. Experts believe the combination of new science, prevention strategies, and global partnerships is a potential game changer in HIV prevention because it removes the burden of daily adherence and offers sustained prevention for months. Betty Mudondo, NTV.